If we can get the Senate to pass what you and your colleagues did last night, how will that play out in areas that don't have a lot of health services in their immediate area? How do we deal with this?
Well, what I've been focusing on, Rev, in my role on oversight is certainly all those vulnerable communities already living on the margins, as you alluded to earlier. This pandemic, COVID-19, has certainly highlighted and exacerbated every socio-ratio political fault line in our country. And I'm just advocating to make sure that when we are talking about those that are most vulnerable, our low-income residents and citizens, those experiencing homelessness, our seniors, that we are also including the incarcerated men and women who are certainly amongst one of the most vulnerable populations, and given the crowding and overpopulating in our prisons, for a confluence of other reasons that we won't get into in this interview, Rev, but you are certainly well aware of, are an ecosystem in a petri dish for the spreading of this pandemic, which is why I partnered with my colleagues, Representative Velasquez, Ocasio-Cortez, and Tlaib, to lobby the Bureau of Prisons to use their full power and to communicate guidance for how we will contain and mitigate this epidemic behind the wall. Specifically, do they have access to testing? Secondly, has anyone already tested positive? And what are the quarantine measures? Again, given the overpopulating and the fact that many of these facilities are already subpar, and that incarcerated men and women do not have access to soap, to alcohol-based hand sanitizers, to regular showers, what is the guidance, both for those that are incarcerated and for staff? And that the BOP use their full powers. I think now would be the time to commute some sentences, to exact clemency, and to take care of our most vulnerable. 10% of those that are incarcerated are over the age of 60 and already have an underlying condition. We should be using compassionate release.
Now, the BOP, the Bureau of Prisons, do they have a plan? Have they responded to those lawmakers that have joined you in raising these questions? Because we're talking about people's lives here.
Absolutely, and bearing in mind, Rev, that 95% of those that are incarcerated will be released. So this is an imminent public health threat for those that are currently incarcerated and ultimately will be released. They did respond to the letter, not within the timeline that we outlined. They did respond, but their response was woefully inadequate. I'm encouraged that while they have stopped visits, that phone calls will be free. But these are the sorts of basic things that should have been happening anyway, which is why I did introduce the People's Justice Guarantee Resolution, a radical reimagining of our criminal legal system that centers the humanity and the dignity of those that are incarcerated. We should be deprivatizing phone calls and things like that. And what's happening in New York, where incarcerated men and women are being exploited for labor, getting paid 26 cents on the dollar to produce alcohol-based hand sanitizer that they can't even use themselves, is unconscionable. So the guidance that we have been provided by the Bureau of Prisons is not sufficient. And again, they do have it within their authority to exact clemency, commutations, and compassionate release, and they should be doing that.
Now, we're seeing in some parts of the country, I know it's done in one contained area in New York, mobile testing, but what about an underserved community where people don't have cars that they can even take advantage of that?
Again, every socio-political fault line is being highlighted and exacerbated in this moment, and we know that there are a great many inequities that exist because of a lack of access to affordable and accessible transit. So mobile testing is certainly one thing to consider. Again, this is a big twine ball, and the more we pull one piece, the more we realize the residual and reverberating impact that this pandemic will have on our healthcare system, on our families of every walk of life, to our economy, and also for those most vulnerable, our seniors, our low income, and the uninsured.
Now, let me go back to where you raised about the incarcerated, because this is not about being sympathetic to those that committed crimes, though they should not lose their rights or their health. But most of them are going to be released anyway, many of them waiting trial. And if they are positive, they will go back into the community untested because the BOP has not done anything to really set a format out to really test them and isolate them or quarantine them if, in fact, they are positive.
That's correct, Rev. And again, that's why we are pushing for the BOP to respond and to offer clear guidance and protocols. Again, our testing kits, have they been made available to them? Has anyone tested positive for COVID-19? And what are their quarantine protocols and policies, both to keep those that are incarcerated safe as well as those who work in these correctional facilities?
All right, Congresswoman from Massachusetts, Ayanna Pressley, thank you for being with us.
Thank you, Rev.
Now let's bring